Welcome to the live checkup. This is where we sit down with Dr. Le Blanc and ask all the possible questions we can when it comes to our health and care. Let me just tell you this first off. Dr. Le Blanc is the medical director and owner of Victoria Clinic, your home for holistic health care in Trinidad and Tobago. Victoria Clinic is located at 54 Galley Street in Woodbrook. Dr. Le Blanc is a medical doctor and certified medical herbalist. She is an integrative health care practitioner, bringing together the eastern and western branches of medicine so as to better guide patients on their path to optimum health. She's also a certified clinical densitometrist, specialist in diagnosis and treatment of osteoporosis. At Victoria Clinic, services offered include medical consultations, traditional Chinese medicine consultations, acupuncture, medical herbalism, blood tests, electrocardiograms, lung function testing, and Dexter bone density testing. You can contact Victoria Clinic at 622-2221 or 622-0683. Follow them on Facebook, Victoria Clinic, or Instagram, Victoria Clinic_Trinidad. Website, www.victoria-clinic.net. This is the live checkup. I'm JD. Now, let's jump into today's conversation. Hey guys, welcome back to another episode of the live checkup. Yes, it's another episode. We haven't forgotten you. We just have been extremely busy, and everyone is affected in some way with COVID-19. So you know how that goes. Of course, I am speaking with Dr. Le Blanc, as I've been doing over the past 2 years. It's official. We're in November. 2 years. Yeah. Still encountering some issues with the internet, but that's how it is. Everyone's encountering that now as we do everything online. But I hope you're well. I hope you're having yourself a great day. And thank you so much for including us inside of your Thursday. I'm JD. Dr. Le Blanc would be on my right, I think. If I'm wrong, then she's on this side. But you get me. Good evening, Dr. Le Blanc. How are you doing?
I'm fine, JD. Good evening. Good evening, everybody.
Good to have you here. I know you've been
Good to
busy.
be back. Yes, it's been very crazy.
2 years. So happy 2-year anniversary, if I can say that.
Happy
The live
happy second anniversary to us, JD.
Yes, yeah. We've been like this, but we're still here, so that's good.
That's what counts.
Yeah, most
in
importantly.
any project. You up and you're down, but you persevere and you persist, and that's
Exactly.
what we're about.
That's
yes,
right there. So the last time we spoke about breast cancer awareness. That was last month, October being Breast Cancer Awareness Month. But you also reminded me that last month was Osteoporosis Month.
We on the 21st was World Osteoporosis Day.
Yes. Day. So even though we just started November, we're still going to dive inside of that conversation because it is a very important topic to speak about. Yes, and I know it's one of your passion projects, if I can say. You always drive the message behind this ever since I've known you over almost 10 years now. Just wanted to say that, by the way. Yeah.
Oh my gosh, it's 10 years already.
But it's almost 10 years. I'm thinking somewhere around 8, somewhere there, lost track, but it's a long time. Since Ebony 104 days. Yeah?
Gosh, we're getting old.
That too.
We're getting old. Oh my God.
Well, that's a good segue because I don't know if osteoporosis only applies to the elderly, and maybe you can tell me straight inside of our conversation, what is osteoporosis? Because I looked it up and they said it's Latin for porous bones, right?
Yes. So osteoporosis is I'm just thrown by the length of our relationship.
Yeah.
Busy, right? As professional, and then became a friendship, and I kid you not, I'm thrown. We need a virtual drink.
That's true. You can do that. Yes.
But yes, I guess our audience should be accustomed to me by now with my craziness and my offbeat nonsense or personality. So osteoporosis, JD. And don't cut this, make sure it goes in. So osteoporosis.
I'm not going to delete this. This is staying. Yes, it is.
Yes. You're right. So JD, osteoporosis is the disease characterized by a decrease in the strength of the bone and the architecture of the bone, the matrix, is actually quite porous. So that's where the Latin comes from, porous bone.
Right.
So in the body, we have osteoblasts and osteoclasts. Osteoblasts make bone matrix. Osteoclasts break down bone matrix. So that is called osteogenesis and osteolysis.
Wow.
So in a human body, we have a normal body, we have a certain rate of osteogenesis versus osteolysis that is programmed. As I tell you all the time, our body's programmed for these activities. With osteoporosis, what we see is an increase in osteolysis versus osteogenesis, so more porous bone. And we generally see this at a certain age. So from birth, JD, we have that normal trend, osteogenesis, osteolysis. But then when we hit our menarche, our puberty, we can tend to see a slight increase of osteolysis versus osteogenesis. And then it recoups again and we go up again. But then, and that's our bone density there. But then when we hit menopause, when women hit menopause, you see much more osteolysis versus osteogenesis. So that is when we become at risk for osteoporosis. And men over 70 as well.
Men over 70. So you just said something which I guess we can delve into later on more, but you just said for women, when women hit menopause, have you, in all the years you've been working with persons who may have this, have you seen pre-menopause?
Yes, you're right. So we do see now perimenopausal women and premenopausal women showing signs of osteopenia, which is the step before osteoporosis.
Okay.
So osteopenia is when the bone density is decreasing but has not reached a certain level. So what happens is the machine, as you know, I'm a certified clinical densitometrist. So I do the DEXA bone density scans. So the DEXA bone density scan will do a statistical analysis of your bone density, and it will go towards a table that was already established long ago, and it does a T-score comparison. So anybody who remembers statistics from university, from school, when we get that T-score, so the T-score, once it goes between -1 to -2.4, that's osteopenia. And from -2.5 and what would be considered lower, but it's actually when the numbers get greater negative, so -2.5, -2.6, -2.7, that is osteoporosis. And normal is anything greater than -1.
So the pre and the peri also occurs in the men? Before
No,
that age you
we tend to see men 70, or again, JD, I must admit or must remind you that the group of patients who have had cancer and are having radiation, and certain chemotherapy agents can cause osteoporosis. So what we tend to do is we do a baseline bone density scan to know where they're at. So if they're in osteopenia, we know to be proactive and give the medication necessary and be proactive with both non-pharmacological and pharmacological therapy to prevent them from going into osteoporosis, because it's a quite silent disease and you can have a silent fracture.
And as you say, silent is something we may not know if we don't do that check that you speak of, but you can tell us some more about that.
You will not know unless you have a fracture, unless you do that bone density scan. Something as simple as a sneeze could break a rib if you have osteoporosis. Yes.
Wow. Now, I was reading something on, I think it was Healthline, and they said 53 million in the US either have osteoporosis or at high risk of developing it. Do you know the stats when it comes to us here in Trinidad and Tobago?
No, but what I can say is that in Trinidad and Tobago, and in the Caribbean on the whole, we're now seeing more of a vitamin D deficiency, and vitamin D and calcium are linked. Right, you're looking up at the sun, but remember that we don't go into the sun at the right time anymore because of the ozone layer deterioration, and because we use sunblock to prevent ozone rays affecting us, then we don't absorb the vitamin D properly, and we usually go from our car to the building. We
Yeah.
don't go out into the sun and relax, between 9 and 10 in the morning and take in those rays. So that is why most of us will have a low vitamin D level. So it's always good to know your vitamin D levels and to boost them.
So you know what? I'm just thinking for a second because my mother would have said something like this. Our era in which we live, even though we have evolved and we've got so much more greater things than maybe when our grandparents were younger, they might have been much stronger than we are right now because they were more in the sun, whether it's tying the sheep and the goat or walking to school. Now here we just have everything with instant gratification. So
Exactly.
yeah,
Exactly. I mean, and we speak of this all the time when we talk about going back to basics with
yeah.
diets and nutrition. And your mother is so right. And that's why I like her guava jam so much
And tamarind sauce.
because and her tamarind sauce and the other treats that I will
I
not
was
mention.
about to say, but yeah.
But the reason I say that is because that is our heritage.
Mm-hmm.
That is part of who we are. And that is part of our ancestry as well, that came from Africa as well.
So
So we need to go back to basics. But your mom is so right, because you didn't have schooling. You might have been taking the goats and cows out, but now you have schooling. But I'm not saying it's wrong, the progress we've made, but what I'm saying is that we have to look for a new balance so that
exactly.
we can still be educated and still do a lot, but still live a healthier lifestyle.
Yeah. Yeah. Of course. Well, evolution is good, but we still need to tap in to make sure that we, live right.
Yes, we need to, and I think we have spoken a lot about COVID and how COVID has reset our lives.
Mm.
And I don't know if you remember during the earliest stages of the COVID lockdown in March and April, when
Mm.
you would catch me in my gym clothes going to exercise and these things, when we were trying our live pieces, that I always reminded you that this was the time for us to look at ourselves, look after
Yeah.
ourselves. So when life gave us lemons, to make lemonade. So I think that was very important to understand and to try and get your sleep cycles balanced, to try and do new things, reinvent yourself, but take care of yourself.
Yeah. So, Dr. LeBlanc, what are the symptoms, if any, of, if even if you can talk about the early stages of osteoporosis? Are there any? If so, what are they?
There are no symptoms. That's it. So the fracture is the symptom.
Mm.
And so it's, I mean, you could get back pain, you could get some pain, but the pain will be indicative of a possible fracture. So this is where we promote screening. And
Yeah.
remember, screening is looking into a so-called normal population. So if you are a woman who's gone into early menopause, you're a candidate for bone density testing. If you are a woman going into perimenopause, you are a candidate. A menopausal, postmenopausal woman, a candidate. Cancer therapy, radiation or chemotherapy, you're a candidate. A man who's going through that therapy or past 70, a candidate. Um,
Living.
if you have family history and you have a strong European lineage, you're a candidate. So, so it's very important to know that osteoporosis screening is something that you do later in life, but it's something that is very important to have done because it's important to see where you are and know your T-score.
All right. So, since there are no shouting signs at us, because you mentioned various candidates, tell us what are some of the first steps we need to embark on in terms of getting that testing done. Maybe someone's coming into your office. What's the first step, and guide us through the test itself and what you're looking at?
Right. So the bone density scan, the DEXA bone density scan is a very simple scan. It's like lying on a beach. You do nothing. It has no pain, nothing.
Right.
And it's very low dose X-ray. So the examiner, the person doing the scan is in the room with you with no problem. So it's
Right.
very low dose X-ray. It's actually called dual X-ray absorption, and that's what densitometry is.
Mm.
You make the appointment Victoria Clinic is one of your places that you can make your appointment. You
Right.
call, you make an appointment for a bone density scan. Your doctor can refer you, or you can self-refer. And when you come in for your appointment, all we ask is that you should not have had any contact done within the last 2 weeks prior to your appointment.
Sorry,
so that's
could you say not have that breakup, like not have any what?
you should not have had in the last 2 weeks prior to your exam any contrast studies.
Okay.
So that's where they may have done a contrast CT, a contrast MRI or MRA or something like that.
Okay.
Also, it's important if you have a prosthesis, so an artificial hip or stomach staples due to stapling of the stomach, you let us know, because we won't be able to do certain parts if there's metal in the body. Yeah. But other than that, you come in, there's no preparation for it, and we do your scan. It lasts the whole procedure will last about half an hour maximum, and very painless. And then we give you well, you won't be able to see, because if it's me doing it, then I'll be talking to you, and so will the other person who does it. So I doubt you will get to sleep, because we'll be there. We put your body into different positions. So generally we'll do your spine, and we'll do your 2 hips. And we can also do your wrist depending on your age and if it's necessary. But we do at least 3 regions, especially if it's a new scan.
Right.
We do 3 regions to get your baseline, to know what's happening.
Is this something I do one-off, or is it like how you do a mammogram every year, or however, is it something you need to do annually?
No, it depends on the result. Depends on the result. So depending on the result, we can do between 12 to 18 months. Sometimes we can give it 2 years. Sometimes we can give it 3 years, depending on what is happening with the patient.
Deterioration or not.
Mm-hmm. Correct. And sometimes when we do the scan, I may have to request further imaging to rule out that there was not a vertebral fracture or a compression fracture in the spine already, which even if your bone scan, the bone density scan shows normal, with that fracture, if it's a compression fracture or if there's a fracture seen, you already are determined to have clinical osteoporosis. So it's important to note that.
Now, forgive me, Dr. Le Blanc, if I'm lost here, just with one thing. Now, remember earlier when you said that there's a pre and a peri for the woman, right? But also you're saying that there's no symptoms unless you get like a fracture just out of the blue, right? So how would one know, what are the things that are happening that one would know that they are pre or peri? Speaking about the females, did I miss that?
No, I was talking about pre or perimenopause.
Right, but they can get.
They can have osteoporosis if they have a fracture. But
right.
when we promote doing screening and the bone density scan in perimenopausal and premenopausal women as a baseline.
As a baseline.
Yes, so, as a baseline scan to know where their bone health is.
Okay. Mm-hmm. So it's kind of like part of the new journey, just to check out when
correct. It's something else that you have to do.
Yes. Right. Did you mention in terms of, you're talking about, we mentioned age and we mentioned age factors and stuff like that, but does poor nutrition have anything to do with this? Usually
definitely
talk about balance, but go ahead.
Definitely. When I find you making fun of me, you leave me in my balance.
I remember,
well,
balance, your ginger, for sure, and exercise.
Well, let me hope you remember that always. So calcium and vitamin D are important for bone health. So this is where we want to make sure you are eating a balanced diet. Most of the modern foods are fortified with calcium and vitamin D. Right. So we recommend to know your calcium levels so that we know if you need supplementation or not. Because if you take calcium in excess, you can then cause other issues from cardiovascular to also just kidney stones or renal colic. So you want to make sure we know your calcium levels. But a balanced diet is important. When we look at dairy for calcium as a calcium supplement, natural supplement, I would say if you can't have dairy, then use a fermented dairy. But most foods, and then there's vegetables such as broccoli that are high in calcium, and certain other green vegetables that are high in calcium as well.
So Dr. Le Blanc, when you're doing the test, yes, that you just spoke of, and you're talking about the three regions and all that. Earlier on, we learned that, or many persons who may not know, but we were reminded that osteoporosis is Latin for porous bones. So is that exactly what you're seeing under this test? You're seeing sort of like, almost like a honey, those.
No. So what you see online is what is seen via a biopsy of bone with electron microscopy. So
Right.
that is when you see the holes in the architecture at a microscopic level.
Right.
What we see on the bone density scan is your bones, your actual bones that we see, and then the computer will calculate the density from the bone density scan machine, from the densitometer. Your density is read, and then that is so you get your bone density on the densitometer, and then the computer will do a statistical analysis from based on your demographic details that I've entered, your age, your race, and so forth, and your sex. And it will then do a statistical analysis and compare it to the established database, which is in the computer. And it will compute and give me a T-score. And that T-score is what I use for the diagnosis.
So, of course, if one is deteriorating, that T-score changes, as you mentioned before.
Correct. So the T-score, the more negative the T-score, the worse your bone health is.
Right.
Correct.
Because I remember reading something earlier on, what is the difference between just osteoporosis and senile osteoporosis?
Oh, okay. So osteoporosis can be then compartmentalized or divided. So senile osteoporosis just means old age osteoporosis. So you got old and that's it. Yes.
But that comes also, does that naturally
with
come
age? It's natural with age. Correct. So we always like to know have a baseline on most people and have the baseline. And so when you have that baseline, JD, you will determine when therapy is appropriate or not. So if I get an 80-year-old with osteoporosis plus a heart condition and other things and other ailments, I will determine if this candidate is really one for pharmacotherapy, or if we should just go along and treat conservatively with non-pharmacological therapy.
And that's the word right there that leads into the next question, treatment. Can you speak to us about treatment, no matter the age? You can break it down in your age factors if you wish.
Right. Treatment, there is one family right now. Well, let me change that. In terms of treatment, JD, we have the non-pharmacological modalities that everybody has to use, which is diet and weight-bearing exercises.
Right.
And then we have the pharmacological arm. The pharmacological arm has a few different drugs involved. And one family is called the bisphosphonates. And the bisphosphonates, what they help to do is they help to slow down the osteoclast activity. So that means we will decrease osteolysis while osteogenesis is happening.
Right.
There are other classes. So, for example, there's a hormone in our body called the parathyroid hormone, and it's secreted by 4 glands called the parathyroid glands, which are located behind the thyroid gland in the neck. Okay. Parathyroid hormone is what regulates our calcium levels in our blood. So they can promote osteolysis, right? And calcium absorption. So what happens is some people may have hyperparathyroidism. So in that case, when we are working up someone for example, a young person with osteoporosis, let's just say, then if we see that, then we would work them up. Anybody who does a bone density scan should actually be worked up if there is osteopenia or osteoporosis. And when I say work up, I mean with bloods. Mm-hmm. So if we see the parathyroid hormone is the problem, we do have a drug to treat for hyperparathyroidism. But we do not have that drug in Trinidad as yet. So most people have to go in. That drug is for 2 years. It treats for 2 years, right? The other thing to note, JD, there's a congenital form of osteoporosis, which comes along with osteogenesis imperfecta. So that's a different collagenous disease that's hereditary and congenital. I'm just putting that out there for you. Then there are some other new drugs that have been discovered or made or produced and approved by the FDA that are anabolic. So they actually promote osteoblast activity. So they promote production of the bone matrix,
Right.
supporting osteoblast activity. Again, we do not have those here as yet. And then there is another drug specifically for postmenopausal osteoporosis that can be used again for 2 years, denosumab. And that can be used, it's used for 2 years, but we do not have it in Trinidad as yet.
Can I ask a question? You mentioned three
Mhm.
things, 3 types of treatments. What's the reason behind in 2020? And we know it's been that kind of year, but why don't we have that here in this new 20th century in Trinidad?
There's the registration process with the Food and Drug Administration here, but not only that, the cost of that medication is quite high. So the pharmaceutical company has to weigh the pros and cons of
Yeah.
investing into registration of that drug here, and will our population be able to afford that drug? Yes, so that is the problem.
And those are 3 types of drugs you mentioned that can help in
Yes,
some way.
yes, but
Right.
we do have new bisphosphonates here. We do have bisphosphonates that you can either drink. So we have the monthly Bonviva. We have a cluster, which is via the vein once a year, IV, Bonviva IV every 3 months. We have Fosamax, which is weekly. And we used to have Actonel, but we don't have Actonel anymore. But we have those for now.
Are those inexpensive or very, I'm just asking?
They're about the same price when you calculate it over a year. A cluster is the most expensive, but it's once a year.
Right.
And it tallies up to the same as if you took it weekly or monthly.
In your years,
And a cluster has less GI side effects because it's bypassing the stomach. So it's important to know that when you're taking the tablet, you have to take it at the same time every month or week, and you have to stay seated and erect for at least 30 minutes to avoid a lot of stomach upset.
in the bio I read earlier on, as we usually do inside the introduction, one of the things that is mentioned that you are also a holistic doctor. So is there anything there out of the garden or the gingers or anything like that that can possibly help the process?
Yes. So in terms of supplements, there's a supplement called strontium. So that's not a herb, that's a supplement. And we used to have a drug here called Protolos that was strontium, but it was taken off because of noted side effects with the heart, right, in a certain section of the population. But in terms of herbs, what would help your bone health, and you could be proactive about it, would include stinging nettle, horsetail,
yes,
horsetail as well, and then other kidney building herbs. So it would include, in Chinese, it's dragon bone or oyster shell. Those are just the names of the herbs, but stinging nettle, horsetail, the Lue du Huang, kidney formula, and any kidney boosting herb, just as du Huang, they will all help the kidney meridian, which is in charge of basically the bone formation and bone health. But local herbs, it will be stinging nettle and horsetail.
So I don't know the horsetail. Maybe I've seen it.
We don't have horsetail here. Well, we probably do, but I don't know the local name as yet.
Wait, but I've seen this stinging nettle, and all you do is uproot that and throw it away. Look how we throw away so many things that can help, right?
Because stinging nettle supports the prostate as well. Yeah.
So when I see them growing wild in my plants, I should just maybe look twice and think twice about it. Yeah.
Well, you don't have a prostate, but you have bones.
No, not the prostate part, the bones, yes.
Yes.
Maybe a future husband, wherever he is, he may need just to keep on top of things with stinging.
As the Spanish say, que Dios te oiga. From your lips to God's. Yes.
I'm taking that, yes. Yes. But yeah, because again, I know I make reference to my mother a lot, but she's just one of those that's always into the grass. Or when I say grass, something green. And, she would come here and sometimes see a wild bargee in some of my plants. And she's like, aren't you using that? And I'm like, no. And I'll uproot and throw it away. So I just thought about the same thing with stinger nettle, uproot and throw it away. When, these things, all of these greeneries or plants have some sort of reason for our life.
Function, yes.
Yeah.
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 And JD, it's so important. And I go around, like I went around my garden this morning. I haven't been able to do it this week every day, but I
Right.
went around this morning and it was good to see. And I looked to see what might have been popping up and what is trying to come up. And well, nothing strange showed up. So everything that has to grow is growing. I didn't see any nettle. I haven't seen nettle in a while.
Really? Oh.
Yeah, my nettle, I don't know, nettle like it decided didn't want me this year. But I have everything growing and now I'm wanting to see what is going to flower. So,
I have, side note, you should see my fever grass. My fever grass is huge. My neighbors watch it and they're like, can we have some? I'm like, come, which I need to be
and
doing.
it's good to share plants. It's good to use your plants. So I'm now trying to see. I threw some pumpkin seeds down the hill, and I'm supposedly getting a pumpkin somewhere. I
Oh,
saw 3 flowers and a pumpkin, so I'm hoping for the best. That
great.
I have some sorrel that suppose looks nice and big, but I see no flowers. So I'm waiting to see if I get flowers this year for some sorrel juice.
Oh, yes, that's true. But that takes a while to be ready. It should have been a year ago. Did you plant it a year ago?
I planted it a while, so I'm going
Oh,
to go
really?
and Google it and see. I probably won't get sorrel until next year, so I'll have to go to the market. But
So,
that's all right.
so you mentioned some of the natural treatments as well as those medicinal treatments for osteoporosis. Do you want to just touch on anything else before we wrap up our conversation?
Yes, I want to touch on exercise. So I
Yeah.
want to make sure that when we as young women and young men, we do a lot of weight-bearing exercises. And this includes simple things as climbing stairs. And if you then get good at climbing stairs and hills like I do, then you put weights on your feet and then give your body a challenge. I encourage you to do squats and so forth, which are weight-bearing, going against the wall and going down, doing that squat against the wall. Very important. I encourage you to look into things such as Qigong and Tai Chi, which help to strengthen the bone and overall energy and vital chi of the body. Um, when it comes to yoga and Pilates, which are core exercises, are very good. However, you have to be cautious with yoga in terms of the twists in yoga if you have back pain and if you have a possible fracture. But those two very important as well. So I encourage you to do, and please, weights, any small weights. So you're not going to become a man, buff and thing unless you want to do weightlifting as a profession, or as fun, but just small weights and doing multiple repetitions after your body weight. That will help a lot with strengthening the tendon attachment to the bone and helps to strengthen the bone in its own right. So I definitely promote exercises, diet, being proactive, knowing your history, knowing your bone health, and just don't give up and looking at your diet all the time.
All right. And I was going to ask you about why the strength exercises, but you just touched on it because it does something to the tendons that attach to the bones. So it's
I
strength.
I did what you always tell me I do.
You read my mind. Yeah. Always.
Yes.
Oh.
Yes. Look into my eyes, JD.
So how can we prevent it before we wrap up? Is there a way to prevent osteoporosis?
Yes. So this is where you know your history, your diet, exercise. That is the mainstay of it. And know your bone health. So if you're in your 30s, 40s, I would recommend a baseline screen to get to know where your bone health is, because you may have, some of us are of African heritage, but we may have some strange Scandinavian, European kind of
Me,
heritage there, and therefore
I
you
don't want it.
might want to know your bone health. So it's important, but I think I know prevention is definitely via diet and exercise and doing the correct exercises and knowing your family history.
Yeah. Okay. So you could just make that part of your annual check or conversation.
Yes, and when you go for your annual checkup, I mean, it's not a usual test that we would do because of financial
Of course.
constraints, but calcium, magnesium, phosphorus, and vitamin D are at least 4 tests that should be done for bone health when you're getting on in age.
So nice of you to say it that way when you're getting on and eat. That's why you put that on my list of things to do annually. The calcium, the vitamin D. Yeah.
Yeah, well, you're getting young, JD.
Thank
So
you
I
very
just wanted to be taking care of yourself, you know.
much. So can you speak to our viewers about, coming to your office? Because you said you do the testing. So just tell us about the process. What are the numbers? How can we contact you as,
Yes,
planning for that?
yes, and we have a special. I'm looking to
Okay.
extend the special. Yes, it's 15% off. It was for October, but we're probably going to extend it either to no for the month of November for 15% off. The scan is roughly $1,200, so the 15% will bring you down to $1,020.
Right.
Most insurance companies refund. We accept carry care and guardian swipe cards, as well as we are able to do a pre-cert for Pan American. So that means that you can probably be, you don't have to pay the full amount if you're on those insurance plans, because we can swipe and your claim will go through depending on your plan that you have.
Yeah.
So we're located at 54 Gala Street, as JD would have told you before, in Woodbrook. Our numbers are 622-2221, 622-0683. And we have a website, www.victoria-clinic.net. And we're on Instagram, Victoria Clinic _Trinidad, and Facebook, Victoria Clinic. So you can find us there. Our website is under a slight construction right now, but it should be back up by this week. And you can actually request an appointment on our website. I encourage you to join our mailing list, the newsletter, which I'm working on all the time. I don't know if JD got her newsletter from me already. I sent out one. I don't know why you didn't. That means you didn't sign up. Bad girl.
I did.
But
You did it on
okay.
my phone.
Okay, so I'll work out and see why.
This meeting conversation. You see what? I was like, no, I'm sorry, guys. I did. Okay.
So we will work that out. But yeah, so look out for that. But you can now request appointments on the website, and we will get back to you. So yes, JD, I mean, for sure, book up and let us know.
All right, cool. So as always, thank you so much for the information on any one of the topics that we touched on. I know Gina keeps telling me we need to speak about vertigo. I'm putting it out there, Doc.
God, Gina. Okay, Gina, next week. Okay, Gina, next week. I have been running from that topic, Gina. Next week. Gina, you're going to tie me up. Next week. It's not that I'm afraid, but
I know you said in depth in terms of a conversation.
Vertigo is such a messy topic, but yes, I have no fear. I'm going to do it, Gina. I embrace and I look towards my fears.
Good, Gina. So you got her to do it. I had to put it out there for you, Gina.
Gina, that was so unfair. I just want you to know. I still love you, but that was so unfair. And I want you to look at me as I say that.
Thank you so much, as always.
That'll be my pleasure. No, my pleasure, JD. And we can't stop. We've been busy. We've had our challenges, but I'm here, and yes, we can't stop.
We've proven that we're not stopping, because if we're standing at 2 years now, that's pretty good. Pretty good. Yeah.
Now we just need sponsorship.
Someone out there, it's just a little sponsorship, because we're bringing the info to you. You know what? A little contribution. Let's use that word. Towards the live checkup. We'd appreciate that.
But it's our pleasure. It's our pleasure to do whatever we can. Yes.
Because we all learn from it. Thank you so much, as always, Dr. Le Blanc. I wish you a great evening, and also the best rest for the week and the weekend coming up. I know you're crazy busy, so thank you for doing what you do. In 30 seconds or less, I like to do this to you, because you work in the field and we're still dealing with COVID-19.
Oh, really?
What do you want to say to us about that? Quickly.
Gosh, I know the beaches are open. Please be careful. Remember, wash your hands, sanitize, wear your mask, cover your mouth and nose with that mask. Stay 6 feet away from people if you can, in closed spaces. Please, please, please try to adhere to the public health guidelines. If you are sick, do not self-diagnose that it's nothing. Stay home and call your doctor or go to your nearest health center. Don't be afraid. Please, 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 let's follow all the regulations.
Can I tell you before I go what I saw last week? I was driving somewhere down south, and driving. You tend to look over in the next car next to you, something like that. And there was this man. I want to directly show you. But when we have the flu, we take the inhaler and we just put it up our nose. Yeah. So he was just driving his car like this. So he looked really sick. And I said to myself, I know he didn't hear me. I'm like, well, where you going? You should be home because when it's up there, it's really sick because you can't breathe, right? I'm like, where you going? So that made me think about some people are just not adhering to, if you are sick, stay home. I was hoping he's going to the pharmacy or something, but still, stay home and see if
stay home.
You understand? Yes. I mean, I was like, if I drove up any closer to him and I tell him, you are supposed to be home.
And next thing you know, somebody pull out a gun on you. You better mind your business. And
you understand?
Boom, boom, boom.
So thank you as always, yes. Dr. Le Blanc.
Yes.
Thank you to those of you that are looking on the live checkup. Thank you for sticking around with us for 2 years. And do continue to stick on with us for the years to come. God willing, health and strength. Yeah?
Yes.
So God bless you all and have yourself a good night.
Bye-bye.
Good to go. The doctor says.
Bye-bye. All right. Thank you.
And that's it. Another episode of The Live Checkup with Dr. Asante Le Blanc. This is where I say to you, thank you for your time. Thank you for listening. Thank you for the questions as well. You help me do my job even easier. And of course, it's always good to have Dr. Asante inside of our world virtually discussing some of the very important topics pertaining to our health. Now, if you've got that topic for a health discussion with Dr. Asante Le Blanc, don't hesitate to connect with us. In fact, send that email to jdsocial868@mail.com. Yeah, and we'll certainly put our heads together and bring forward another one of the episodes with you in mind. So don't forget, jdsocial868@mail.com. Check out my website as well if you're looking for any voiceover talent or maybe a host for an event, whatever it may be. Check it out, www.jdmedia868.com.